Okay, my name is Matthew Steinberg. I practice functional integrative dental medicine in Austin, Texas, and have been doing that for 34 years. I don't even think of myself as a traditional dentist. Well, that's wrong. When I first started out, yes, I did. Because I was thinking about just teeth. I don't think about teeth anymore. I think about total body. I think about the oral environment. So I'm treating the oral environment, and the teeth just happen to be a part of that oral environment. And now there's so many new things coming out. We're learning there's a whole new paradigm coming out called DTR, which is exclusion time reduction. And what it means is when teeth touch, we know now when people swallow, they swallow up to 20,000 times a day. When they swallow, teeth touch. If teeth touch and rub on each other, back teeth, it causes the sensory organs within the teeth to send messages to the brain that can cause TMD problems, headaches, migraines, and everything else. So we're learning now to really look at how teeth touch. And there are digital products out now that we're using in our office, and other dentists are using too, to where, I don't know if you've ever had any dental work done and they have you bite down on the paper. Paper's out now. We have you bite down on a digital wafer, and the digital wafer will show in microseconds which teeth touch evenly and which don't. And by adjusting the bite, you can correct headaches, TMD, and everything else. So it's amazing what we're doing now. I love dental medicine now more than I ever did before because of all the new technology. Well, more dealing with people with head and neck pain, with TMD, with whether it be internal with your joints, the temperament. A lot of people will say, I have TMJ. Well, everybody's got TMJ. That means temporomandibular joints. It's like saying I have a knee. What it really is TMD, temporomandibular dysfunction. And some people, because of genetics, because of the way they were, because of orthodontics, because of putting their jaws in different positions, they cause destruction of their jaw joints. And they have true pain here. 80% of true pain in the face is related to muscles, and it's muscle fatigue, lactic acid building up in muscles. So if you can get people relaxed, sort of what's done here at Hippocrates, it's all part of the same sphere. If you can get people relaxed, get people to think differently about their health, nutritionally, their posture, everything, you can really create a person that is totally whole from the head to the bottom of their toes. Well, the key thing to me in any part of medicine is interviewing people and getting to know where they're coming from, what their problems are, what their chief concerns are. So when a person calls our office, we spend at least an hour to an hour and a half getting to know them. That's critical. That isn't done in medicine anymore. Definitely not done in medicine because everything's insurance-based. They don't have the time to sit down with people. We still have the time to sit down with people and get to know them. So we do that, then I get people in for a really thorough comprehensive exam, which involves periodontal disease, head and neck, oral cancer. We're known for all over the state for doing extremely thorough oral cancer exams. Oral cancer now is rampant because of misdiagnosis. So we do that. We check their bite. We look at them aesthetically if people want aesthetic changes. I still do dentistry, a lot of veneers and things like that. That's still a major part of our practice. But it's not the thing that really excites me now is getting people on a wellness path, on a total wellness path. That's what's important. Well, it entails working with them, finding out where they're at now, looking at them nutritionally, looking at them from a stress management standpoint. We use Newcom a lot in the practice, which is a new product that works on reducing sympathetic activity in the body to parasympathetic. So within 6 or 7 minutes, I can get somebody to a relaxed state, like meditation. So I do that. And then we really work with them, finding out what their true issues are. And we individualize it. Everything's individualized per patient. There is nothing cookie cutter in my practice. And there shouldn't be in any practice. I mean, if I was dealing with you, you want me to deal with you personally. That's so important. And if you look at foods, a food group that really causes the most inflammation, you're looking at sugars. And it doesn't really matter if it's refined sugar, if it's date sugar. I mean, obviously white refined sugar is probably the worst. I mean, even if you eat excessive fruits, there's a tremendous amount of fructose in sugars. So sugars really cause the most inflammation by far of any food group. That and processed foods. I mean, I recommend everybody, of course, Whole Foods, I'm practicing in Austin, Texas, Whole Foods is there. So I grew up with the whole food mentality. But really eating nutritionally a plant-based diet is so, so important. It depends. If there's inflammation in the mouth, say the gum tissue, say people brush their teeth and they say, I bleed all the time. Or they floss their teeth and they say, there's blood all over when I floss. Then you know there's something going on systemically in addition to orally. It's not just localized. But the thing is, with an oral infection, those bacteria, those strep bacteria, migrate through the body and lodge on heart valves, pancreas, kidney, every organ. So you've got to have an immaculate mouth if you're going to be totally healthy. It's critical. We don't know. That's a great question. No, we don't. So that's why you have to look at somebody totally. You've got to look at their diet, their exercise, their stress levels, and everything else. No, I mean, if you have problems with the microbiome in the gut, you'll have problems in the mouth. Conversely, if you have problems in the mouth, you're probably going to have problems in the microbiome, in your gut. So they work together. We don't know everything yet. Boy, I wish we did. I told a patient last week, I wish we were like a car. You can take your car in and plug it in electronically, and they can tell you what's wrong in your car. I wish we could do that to our bodies, but we can't. Not yet. It's coming. I think within 10 or 15 years, we'll be able to really do a thorough diagnosis. Well, one area that really excites me is in salivary diagnostics. Within the next 2 years, we'll be able to take a sample of somebody's saliva and be able to tell them how healthy they are totally, not just mouth-wise. We'll be able to find cancers and everything else. UCLA is doing tremendous research on this. They've spent almost $1 billion on this research, so it's coming. So it's not just going to be blood anymore. It's not just going to be hair analysis. It's going to be salivary diagnostics. I see dentistry merging with, I hate to use the word, with medicine. I think it'll become a subspecialty. I just hope dentistry doesn't go the way of where medicine is now, where it's being controlled by big pharma, pharmaceutical companies, and with insurance companies. Dentistry isn't yet. That's what keeps us independent. So, and that's why I can spend time with people. And I don't, I keep my fees normal, so I don't, it's not about nickel and diming people. It's about finding out what people really want. It's about taking people to a place they could not have gotten without me. That's the key. Austin had a huge debate on that. The fluoride in water, pretty much against. Because after teeth totally develop, after the age 12, fluoride in water does no good at all. Zero. Topical fluorides, and there's a lot of natural fluorides. You got to realize there's a lot of fluoride comes from a rock. It's a natural fluoride. Fluoride really makes a difference on teeth because it forms a hydroxyapatite on the teeth, which makes them less resistant to, without fluoride, they're less resistant to acid attack. But the key is, if you control your diet, if you have a low acidic environment in your mouth, you're not going to get tooth decay. The oral bacteria that cause tooth decay, the strep bacteria that cause tooth decay, thrive in an acidic environment. So you control the acidity, you control tooth decay. So fluoride isn't needed for everybody. But is it a total poison like it's being promoted? I don't think so. I don't promote fluorides tremendously in my office. I promote a healthy oral environment. And you can do it without fluorides. So what a root canal is if inside each tooth there's a blood supply called the pulp. If that pulp starts to degenerate for any reason, it becomes bacteria invaded. So you've got to go inside the tooth and clean the tooth out, get all the bacteria out. That's what a root canal is. It's cleaning out the internal part of the tooth, of the canals. Then once they're cleaned out, you put a filling material in there to fill them and seal it. And then it's supposedly taken care of. The debate in root canals now, or endodontic therapy, is that they're not cleaning out all the bacteria. And so they're leaving bacteria in the tooth, so there's always an infection going on. If that's true, then either the tooth needs to come out or the root canal needs to be redone. But the problem is finding these bacteria. Well, now within the last 10 years, we've got 3D imaging that we can do, and we do it in our office. So what I'll do is I'll get a patient in, and I'll do 3D imaging. It means you can take a tooth and rotate it 360 degrees. If there's any infection coming out of that tooth, you'll see it on the 3D x-ray. So if people have root canals and I don't see any infection within the tooth, I don't recommend they have them taken out. But the question is, you don't know unless you do a 360. You just don't know. But the question is, they're recommending taking all these teeth out that have had root canals. What are you going to put back in? You have to chew, you have to eat, you have to support your jaw joints. So the same people that are against root canals are also against implants, because implants are titanium. Well, titanium is the same thing they use in your hips or in your arms or whatever. There's no problem there. There's really been no documented proof that a titanium implant causes major issues, that it's toxic. So if you don't do implants and you remove all your teeth, what are you going to put in there? The only thing you can put in is something removable, like a partial denture. Well, they're made from plastics, methyl methacrylate. So there's nothing that you can put in your mouth that is totally non-toxic to chew with for the rest of your life if you remove your teeth. Now, implants you could, because an implant is a titanium root, and then you basically, I'm making it simple, screw in a zirconia, which is non-toxic, crown on it, and you're fine. But if somebody says no implants, no root canals, then you're left with really very few options. So that's the dilemma. That's the real dilemma now. But if you do a 360 imaging, it's called a cone beam CT scan. If you do a cone beam CT scan, and they're not that expensive, you can see infection any place in the mouth. It picks it up. Yeah, so if you ask me, am I for, am I against? I think if the endodontic therapy is done correctly, and the new endodontists use microscopes to get in there, if you do it that way, if you're sure there's no residual infection, then I think a root canal's fine. I'd rather have my natural tooth than have it taken out and have something artificial put in. And then cost-wise, it's a lot less expensive.